Okay, Angelina, I'm going to put your hair up so that I can take a look at your spine. How does that feel? Okay. I'm going to start by palpating your atlas and axis, which are the first two vertebrae from the cervical region. Sometimes we may have some pain in the lower part of the back that originates from the neck area. There's a lot of instability going on here. Any pain as I'm pressing down on the mustard bone? No. Okay. Okay. Let me know if you feel any type of electrical stimulus going down the spine. It might feel kind of like a zipping or electrical wiring.
It just feels tender.
Okay. But I'm going to be tapping on your spine, and that's what I'm looking for to see if there's any abnormal neurological reflex.
I'm feeling something right there.
Okay. This does feel a little bit prominent. I'm gonna be very gentle. I'm gonna do a temperature variation as well.
Feel good.
Right here. Okay, so that's T4. I'm gonna come back to this. Slight inflammation on the lumbar region. Checking for any deviations of the spine. Sometimes it is normal to see a little bit of a shift, but I don't see anything here. Let me know if you feel any type of electrical activity moving down the spine. Right here.
something right there.
Now we're looking to see if there's any variation between left and right. Sometimes it could be on both sides, sometimes it could be just one side.
Right there.
Variation is definitely not symmetric. But it does travel from the right shoulder into the scapula, moving down through the thoracic area, and does stop at the end of the thoracic region. Looking at the intercostal nerves and movement. Very little space and not sensing a lot of flexibility. Okay, so I'm going to touch you with a soft surface. Go ahead and tell me when you feel this. Just say no.
No. No. No. No. No. No. No. No. No. No. No. No. No. No. No.
Okay, I'm going to be focusing on this side. I'm going to touch you with two textures. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to be dull. This is what dull is going to feel like. Can you feel the difference?
Yeah.
Okay. So tell me what you feel.
Sharp. 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 Dull. Sharp.
Is that sharp or dull?
I didn't feel it. Dull. Sharp. Dull.
We're looking for numbness, and there is a little bit of numbness in this area. Now we're going to test the paraspinal side.
sharp, sharp. Sharp.
Okay. Now go ahead and tell me if you feel this sharp all the way.
Yeah. It ended about mid-back.
Okay. Somewhere over here.
Yeah.
Okay. Now go ahead and tell me if you feel this dull all the way.
Yeah. Yeah.
And does this feel the same on the other side as it feels here?
I feel it more on the left side.
What about now? Does it feel more on the left side than it does here?
Yeah.
And now?
That was even.
It was even. So it does stop about here and it starts about D5. Okay.
I felt it more on the left. That one was about even.
Even. Okay. Go ahead and tell me if you feel less warm or cold.
Cold. Warm.
Okay.
Cold. Cold. Warm. Warm. Cold. 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 Warm. Cold. 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 Warm. Cold.
Okay. Go ahead and tell me if you feel less vibration or just pressure.
Vibration. Pressure. Vibration. Pressure. Vibration. Pressure. Vibration. Vibration. Vibration.
Okay. Let's see. I'm looking for asymmetry. Left shoulder is more elevated at the spinal region. It's about 11 exactly. 9.4. Nine. That's 11. Okay. I'm gonna look for temperature variations in the paraspinal region. some light ankle movement there. Okay, there's a lot of inflammation in the upper region. That's where we're going to be focusing. We need to be able to increase flexibility. Slight angle movement there. And it does correspond to that line. Okay, we're looking at latitude. Temperature variation there as well. Does stop right at the end of the thoracic region. I'm going to listen to your back. I'm going to have you take a deep breath in and then exhale. Slight crackling sounds. Okay, I'm going to do a spine adjustment. Going to feel like a popping sensation. We're trying to increase the spaces in between the vertebrae. Focusing on the points that have lower variability. This increases spine mobility. It allows for smoother and easier movement. Okay, we're going to adjust your occipitus as well. And your atlas, which is the most important vertebrae, I would say. It's very hidden, right? The first vertebrae that attaches to the cranium. And touching a little bit on the axis. I'm trying to relax these muscles that attach at the base of the cranium. Applying slight pressure on these points. This helps to minimize any discomfort during the adjustment. Okay, I'm gonna feel slight pressure now. Trying to activate the nerve cells. Any pain as I'm doing that? Okay. This doesn't penetrate the skin. It just activates the nerve points. That helps with muscle tension. Okay. Slightly trying to activate these points. How does that feel? Okay, now we're smoothing the muscle. It's sore. Okay. There are all these points on the spine that I'm a little bit concerned of. I would like for less fluid buildup and to be able to decrease these inflammation points. So that's why we're trying to activate the tissue behind it. Okay, I'm going to do skin pulling. This helps to increase circulation in this area. It's going to feel kind of like a pulling sensation. Okay. It's definitely more inflammation as we're going up into the trapezius. This is where the first electrical sensation happened. Okay, I'm gonna feel like a popping sensation. We're going to crack the spine. Okay, take a deep breath in and breathe out. And again, breathe in, breathe out. Okay. And again, breathe in, breathe out. I'm going to focus on the scapula. I'm gonna ask you to give me this arm. Go ahead and try to touch the middle of your chest here in the back. I'm going to press down on the middle of the palm. Go ahead and tell me if you feel any pain shooting down the spine, okay? Okay. Go ahead and keep it like that. Just sliding my hands here under your scapula. Any pain here? Okay. There's not a lot of space, so very little flexibility. I'm just going to go ahead and adjust your scapula. Keep your arm like this for me, okay? Breathe in, breathe out. Okay, let's go ahead and see how that feels. Okay, perfect. Okay. I'm going to apply an anti-inflammatory oil. It's going to feel kind of like a warm sensation down the spine. That's very normal and expected. Okay, I'm going to use dry cupping now. It's going to feel like a squeezing sensation. It helps for the blood to be pulled to the surface of the skin. It helps with inflammation of the muscle, and as I'm sliding down the cup, you're gonna feel a relief. So blood comes out, and we're just gonna drag it down. It helps with any fluid buildup. And this is where everything comes from. Kind of feel the pressure down the spine since we're trying to activate the spaces in between the vertebrae. Okay, you can definitely see an improvement in the natural movement of the muscles. Okay. There's definitely less inflammation in this area now. Just trying to create a suction so that we allow the muscle to shrink. Definitely less inflammation on the left side. Slight movement at L1. We should definitely see less fluid build up as we're doing that treatment. I'm going to work on the lymphatic drainage since there is some inflammation in this area. Just moving the lymph down from the neck region so that it gets removed through the lymphatic drainage. Very gentle strokes here, trying to activate the natural detox system. You have your warm medicine balls. First, we're going to apply pressure in the occipital area. It helps with inflammation and to lower cortisol levels. The medicine has anti-inflammatory anti-slippery properties. Okay, go ahead and take a deep breath in and fully exhale. Good. And again, breathe in and exhale. Okay. One more time, breathe in, breathe out. Good. Okay. Just going to do some manual adjustment here. Breathe in, breathe out. Breathe in, breathe out. Okay. Okay, we're going to do scalp therapy as well. Okay, we're going to scrape these abrasions that have been building up behind the ear. And this is a scalp treatment adjustment. It does help to lower the adhesions and allow for better movement. I'm going to do hair pulling, just moving and creating that gap that allows for the tissue to regenerate. Okay, definitely less tension. It starts to decrease. Okay. Hi, Angelina.
Hi, how are you?
I'm good. How are you doing?
I'm good, thank you.
Thanks for coming in. My name is Dr. Matt. I'm going to do your exam today. Can you please verify your date of birth for me?
It's July 21st, 2000.
And your last name?
It's Rose, R-O-S-E.
Perfect. What brings you in today?
I'm kind of breaking out a little bit on my skin, and I just wanted to get my skin checked out, make sure that everything was doing okay.
Okay, so skin evaluation. Have you noticed any other breakouts anywhere on the body?
Kind of on my shoulders, but other than that, it's just my face and my shoulders.
Okay. Do you have any family history of skin disorders?
Not that I know of.
Okay. And do you get exposed very often to sun?
Yeah, I do work outside, so.
Do you wear sunscreen? Have you noticed any burning sensations? Any itchiness?
Only when I put makeup on.
A little bit of burning?
Yeah, especially like right under my eyes.
Okay, so since you're having these type of symptoms, I want to rule out anything that could be requiring some treatment. I'm going to take a look at the whole skin, especially on the upper body, and look in places that you cannot usually look at. Okay. Are you taking any medications on a daily basis?
No.
And have you had any procedures done in the last couple of months? Have you had any facials in the last month?
I went to a spa about 4 months ago, but other than that, no.
And what kind of treatment did you have?
I just had a massage, and then they did do like a steam facial, but they didn't put any other products on.
Alright, I'm going to sanitize my hands, and we like to start with vital signs first to make sure that everything is healthy. So first thing we're going to do is to take your temperature. I'm going to put this under the tongue. Have you had anything to drink, cold or hot, in the last hour?
I only had water.
Water. Was that room temperature?
Yeah.
Okay. I'm going to put this under the tongue. Go ahead and hold it for me. Thank you. And this will go on your index finger. Perfect. Go ahead and relax. This measures your oxygen and heart rate. Okay, your respiratory rate is not labored. I would say about 14 breaths per minute. Oxygenation 95% on room air. Heart rate is relaxed 86. And let's check temperature. 96.8 Fahrenheit, that's good. Okay, let's take your blood pressure. I'm going to take this. Alright, I'm going to use your left arm. Sorry, give me 1 second. So we're going to match this with the artery. Okay, go ahead and relax. Legs are uncrossed. Okay, this is going to go right under the elbow. This is going to feel like a big squeeze. (100/50). It is a little bit too low, especially the diastolic, but we'll keep an eye on it. Do you feel dizzy or like your heart is beating too fast? Okay, I'm going to listen to your heart. Is that okay? Okay, go ahead and relax. Go ahead and take a deep breath in and breathe out. Again, breathe in and breathe out. Okay, I'm gonna have you turn a little bit towards the wall so that I can listen to your back. Perfect. Breathe in and fully exhale. And again, breathe in and breathe out. Breathe in. One more time. Okay. I'm gonna have you lay down and I'll take a look at your skin now. I'm going to put gloves on and I'll start examining your skin. You mentioned during medical history that the most concerned area is right under your eyes.
Yeah.
raised bumps. Noticing quite a few blemishes. First, I'm going to take samples. I want to make sure that we are not dealing with resistant and antibiotic resistant bacteria. And this will allow us to make sure that if there is an infection, it's not spreading and it stays localized. This one is 0.1. This one is 0.1 millimeters. I'd say it's pretty small. We can definitely neutralize it here in the office. On the right cheek, quite long, this one, 0.3 over 0.1. Right under the chin. Let's go ahead and write this down. On the right cheek. Over 0.1 millimeters. a few samples here. We do not want to mix the fluid. Okay, we have sample 1. Now we're going to take a sample from the chin area. Okay, so we took 3 samples. We're going to send these to the lab. Now let me go ahead and take a look at your ears and behind. I'm going to have you turn your head towards your right. Okay. Noticing a little bit of redness in front of the ear. Tragus looks intact. Noticing a little bit of redness behind. We can do an antimicrobial cleaning of the tragus. start with a basic solution. This is going to feel a little bit wet. We're applying the second antimicrobial solution. Let me know if you feel any kind of burning sensation. We're trying to clean around the ear canal. Okay, your ear is very clean now. I'm going to go ahead and move to the right side. Go ahead and turn your head the other way. applying the same basic solution. It's gonna feel a little bit wet. A little bit cold. We're cleaning the entrance of the ear canal, mainly looking at the skin to make sure that it is well perfused. Applying a saline solution to neutralize the pores. Okay. Let's go ahead and take a look at your abdomen now. Okay, Angelina, I'm going to slide my fingers around, trying to feel for any blemishes that could be raised. Gonna feel kind of like a pinching sensation. I'm not noticing any redness. Feeling a little bit of cyst-like formation under the skin on the left quadrant. Okay, the right side feels normal. I'm noticing a few white spots we're looking for any raised bumps. Okay, I'm noticing a little bit of goose bumps on the right side. That could be from nerve damage. Are you experiencing any tingling sensations on the right or left side?
Mostly on my right side.
Okay, that definitely aligns with what we're seeing. There's one small blemish that we need to keep an eye on. So let's go ahead and make sure that you have it in your chart. It is a little bit black, mostly brownish. Say not elevated. Margins are a little bit defined. I'm noticing some ramifications. Let's see if there is any inflammation around it. Tiny bit of inflammation on the left side. It's gonna feel a little bit ticklish. Just trying to see how much tissue is affected around it. And these are healthy moves, so I'm not concerned, but it's good to have a baseline of everything that you have on the upper body. And then, since this really takes a long time, we can schedule another session for lower body skin evaluation as well. I'm going to percuss, so you're going to feel kind of like a tapping sensation. We finished with the right upper and lower quadrants. Moving to the left quadrant. Good. And left lower. Okay. I'm going to listen for any abnormal sounds. This is going to feel a little bit cold. Skin is well perfused, a little bit diaphoretic. Let's take some measurements. Fifteen, 6. I'm not seeing any inflammation. Just checking to see if there is any redness. A little bit of blanching, which is totally normal. Noticing a little bit of fluid buildup under the skin. Some edema. Okay, we must go ahead and mark those two spots. I'm just going to put a dot right next to it. Okay, let's go ahead and check your back now. I'm going to start with measurements. 41.7. I'm looking for an asymmetry. Point 35.1. For any breakouts, skin elevations, starting with the neck base. Noticing quite large skin growth that has margins a little bit in a zigzag form. Noticing two colors. It is round, but a little bit asymmetric, so I do want to see if we can remove it and send it to the lab today. Noticing quite a large spot under the left scapula. It looks like a birthmark, and it's almost like a stain. It's very common to be born with a mark like that. This looks like an old blemish that has been healed, just left a little bit of a scar. So let's go ahead and measure this and see if we can remove it. 0.6, that's quite large. 0.2. So on the back, we're going to do one incision. Okay, some margins. We're noticing two colors. It is round. Okay. First, we're sanitizing the area. I'm going to apply a numbing solution. I'm going to let this sit for a few minutes. You should not feel anything at this moment. We just want to make sure that we're getting all the margins. And we're going to send this to the lab to have it checked. This will allow us to have a baseline. So going to apply a dressing. You want to make sure that it stays clean. I'm going to take a look at the right side. I'm noticing one blemish. Okay, just one of them is elevated. Just checking for any redness. It's gonna feel kind of like a pinching sensation. We're looking at skin hydration and if there's any vitamin deficiency. going to apply a solution that will help to lower the acidity of the skin, and it's going to diminish the blemishes. And then we're going to apply a scrub. Marking the treatment that we did today. I am going to have the results back in about 2 weeks. Okay, so I'm gonna have you stay away from sun exposure for about 2 weeks while the treatment is still applied. Now, we did do a scrub, so that's going to diffuse the dead cells that are being released. And the mole that we extracted looks very good. It looks like we did extract all of it. There is none left. And I applied a clean patch that you can take away, remove it when you go in the shower. The incision should heal in about 2 hours.
Thank you.
You're welcome. Good. Can you squeeze my fingers? Okay. Sure. Good. Hi, Angelina.
How are you?
I'm good. How are you?
I'm pretty good.
My name is Dr. Matt. I'm going to do your exam today. Can you please verify your date of birth?
July 21st, 2005.
Okay. And your last name?
Rose. R-O-S-E.
Perfect. Go ahead and tell me what brings you in today. What's happening?
So I had gone to my doctor because I was experiencing some jaw pain on my right side, towards the back. And it's mostly when I'm laying down going to bed, and I just feel like a pressure here. And then also I've noticed that when I'm laying down, my nose starts to run as well. And my doctor had referred me here. And to hopefully look at it and see what's going on. I've had some pain on my neck as well. It's mostly on my right side, but I am feeling it a little bit on my left as well.
Okay, so let's back up a little bit. The jaw pain, when did it start?
Maybe about 3 to 4 weeks ago.
And when did you notice the runny nose?
Around the same time.
Are you experiencing any stuffiness?
Yeah.
Okay. The neck pain, how long ago?
It was all around the same time.
Same time. Okay. And you showed a lot on the right side? That's where the pain is?
Yeah.
Okay. Are you experiencing any pain on the left side?
Yeah, the left side it does. It does have some pain as well, but it's not as often as the right side or as harsh as the right side.
Okay. How would you rate your pain?
Maybe like a 6.5 or 7 out of 10.
Okay. Have you noticed any clicking of the jaw?
No, I haven't noticed it, but when I yawn, occasionally it'll click.
Have you noticed any changes with your sense of smell?
I've noticed that it's not as strong, and it's kind of hard for me to smell like scents that are burning in the house, like a candle or like a wax warmer.
Okay, so it diminished. And for the neck pain, is it radiating more towards the spine or towards the shoulder?
It's definitely more towards the shoulder than anything.
And are you experiencing any new onset of headaches or migraines?
I've had a couple migraines lately, mostly when I'm at work with the brighter lights.
Do they go away with medicine, like ibuprofen?
The medicine helps with the pain, but it doesn't make it fully go away. I'll usually put like a rag on my face or
Okay. And when was your last dental checkup?
around 6 months ago.
And have you experienced any of these symptoms before that dental checkup?
No.
Okay, do you have any history of root canals or tooth implants?
No.
Okay. What about any tooth surgery or jaw surgery? Are you taking any medicine on a daily basis?
Not currently.
And do you have any allergies to medications?
No.
Okay. And where is your pharmacy?
Walgreens on Red Line Street.
Okay. It looks like we're gonna tackle a few points. One, we're gonna do a cranial nerve exam. I want to make sure that there's no nerve damage. And then we're gonna take a look at your jaw, nose, and neck plus shoulder. We'll go from there and see what direction, what treatment we need to do. Okay. I'm going to sanitize my hands and we'll take vital signs first. Okay. This will go on your index finger. So I'm going to take a look at your heart, your oxygenation. See if you have any temperature. And have you had anything to drink in the last hour?
Some water.
Okay, was the water cold or warm or room temperature?
It was cold water.
Okay, so we'll keep that in mind when we're taking a look at this value. I'm just going to put this under your tongue. I'm going to have you hold it. Thank you. And then we're gonna measure your blood pressure as well. Okay. Oxygenation is 96, 98%, heart rate is 71. Under there. Respirations are non-labored. About 18 per minute. Okay, I'm going to take this and let's check temperature. 97.1. Alright, is it okay if we take off the sweater so that we can... Okay, I'm gonna put this on your upper arm. Do you have any family history of high blood pressure?
I do, on my mom's side.
Okay. And you're not taking any medicine for hypertension? Okay. Blood pressure a little bit elevated, 135/60, but it could be from the pain that you're experiencing. That is definitely a sign. Okay, I want to make sure that there's no cardiovascular disorders here, so we're going to take a look at your heart rhythm. It's going to feel a little bit cold. Go ahead and close your eyes. I can hear only S1 and S2. No S3, no S4. Go ahead and take a deep breath in and breathe out. And again, breathe in and breathe out. Okay, no wheezing, no crackling. That's very good. Okay. I'm going to check your reflexes. Go ahead and relax your jaw for me, please. A little bit more, slightly opened. There you go. Good. Relax your shoulders. Okay, go ahead and relax your elbow here. Perfect. Okay. Reflex is a little bit diminished on this side. Go ahead and relax. Okay, very good. Good. Okay. Let's go ahead and check your reflexes. So first I'm just going to take a look inside your mouth. Go ahead and give me a big ah. Okay. Please move your tongue up and down for me, side to side, and push with your tongue inside your cheek and the other side. Perfect. Go ahead and give me a big smile. Okay, a little bit looped on the right side. Go ahead and give me a frown. Same thing. And I'm gonna try to push down on your eyebrows. Don't let me do that. Okay, that's good. Now I'm gonna try to push your head towards your right side. Don't let me do that. Same thing on the other side. Okay. Go ahead and shrug your shoulders for me. A little bit stronger than that. Okay. Can you squeeze my fingers? Okay, very good. Now go ahead and look straight at my nose. I'm just going to flash a light in your eyes. Okay. Now I'm going to gently press down to see if there's any discoloration. Okay. Okay. I'm going to check your ocular reflex. Okay, go ahead and look straight right here. Good. Good. Okay, I'm going to check your tympanic membrane. Go ahead and look that way. Good, I'm not seeing any redness. Membrane looks good. Any pain here? And what about the other side? Any pain here?
Slight pain.
Okay. I'm gonna have you lay down and we'll do more tests and see what we can do about it. Also, we're gonna do a dental checkup. Okay. Okay, I'm gonna put a fresh pair of gloves on. Okay, I'm going to start by just slowly palpating your jaw. I know that you do have concerns of jaw popping, and it could be a sign of TMJ or some other disorders. We're going to take a look at the connective tissue as well. I want to see exactly if there is any limit in the range of motion. We're also palpating your lymph nodes. It is definitely part of the dental checkup. Okay, I'm not feeling pre and post-auricular lymph nodes. Submental are also normal. Moving down to the cervical lymphatic drainage. Okay, I'm going to check your sinuses. So I'm going to press down on each side of your nose. Okay, paying more attention to the right side than left, just to make sure that we're ruling out anything in the connective tissue. The left side feels definitely less swollen than the right side. feeling the musculature of the jaw to see if there are any knots that we can feel. Sometimes there may be some nodules that are constricting the blood vessels. Go ahead and breathe in, breathe out through your nose. Okay, definitely constricted on that side. Breathe in, breathe out through your nose. A little bit of constriction as well. Just slowly going to palpate the nose. I'm not feeling any nasal septum deviation. Going to do a taste check. So I'm going to put something on your tongue. I'm going to have you identify what this tastes like, okay? Go ahead and open.
It's just really bitter.
Better. Good.
That one kind of tastes like citrusy.
Citrusy?
Yeah.
Okay. Okay, I have here a few samples for smell. Go ahead and cover your right nostril for me. Perfect. Go ahead and breathe in, breathe out. And tell me if you can identify this smell.
It kind of smells like a seasoning, kind of like garlicky.
Okay. And cover your left nostril. Breathe in, breathe out.
Oh, that one was more floral.
Okay. And now you can breathe in with both ears.
That one kind of smells like I love it.
Okay. I'm going to do a hearing test. I'm going to whisper some numbers in your ears. Go ahead and cover your left ear first and repeat the numbers. 1955.
1955.
Okay, now cover your right ears. 1978.
1978.
Okay. Go ahead and tell me which position here is louder, position 1 or 2. So this is 1. And this is 2.
2.
This is 1 and 2.
2.
Okay. Go ahead and tell me when you don't hear the vibration anymore. Do Do you hear this equally on both sides? Go ahead and tell me when you don't feel the vibration anymore. Okay. I'm going to do a sensation test. I'm going to touch you with two objects. One is going to feel kind of sharp, but it's not going to penetrate the skin. And then the other one is kind of fluffy. It's a dull sensation. I'm just going to show you what it will feel like on your chest here. So this is sharp, and this is dull. Okay. Sure. 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 Going to palpate right behind your ears. We're looking at the masseter bone to see if there is any inflammation. Any pain here? Okay. What about on the right side?
But when you go down a little bit, there is.
Okay. Okay, I'm going to give you these glasses. They're going to help protect your vision. So we're going to turn on the light here. Is this comfortable? Yeah. Okay, so we're going to turn on the light. It's going to be a little bit bright. Okay, I see that your lips are a little bit dry. I'm going to apply Aqua 4. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going to feel the Aqua 4 on your lips. Okay, so you're going Perfect. Okay, Angelina, I'm going to inspect your tongue first. Let me go ahead and adjust the light here. Very good. So go ahead and open your mouth. I'm just gonna grab the tongue and slightly move it to the right and left. We're looking for any abnormal lesions. Okay. Tongue looks symmetric. Okay, we're gonna choose this one. Okay, go ahead and open your mouth. So first you're just gonna feel the light. Okay. I have here just a mirror and I'm taking a look at the molars here in the back. You're gonna feel a very gentle tap. You can go ahead and lift your right arm up if you feel any kind of pain or tenderness. We're looking for cavities or infections. I'm noticing a little bit of tartar buildup. Are you experiencing more pain when you chew?
I'd say so, yeah.
Okay. So when you chew softer or harder stuff?
Mostly harder stuff.
Okay. Any pain here?
It's light.
Okay. Good, taking a look at the gingiva. It looks pink. I'm not seeing any lesions. Okay. The most important part is to see if there is any tooth damage. I see that you do have a root canal, so you and the root canal looks good. I'm not seeing any infection on that tooth. The gingiva is a little bit protruded medially. Any pain when I'm pressing down here?
It's just a little bit, but It's definitely towards like the back.
Okay, let's go ahead and check your upper teeth now. Okay. I'm not noticing any lesions. Soft palate looks normal. Any discomfort on the left upper side? Okay. Okay. What else? Okay. I'm going to check your bite now, okay? So, just 2 fingers I'm going to put on each side. Now go ahead and gently open your mouth the best and the most that you can, and slowly, good, and close it. Okay, slight deviation to the left. Go ahead and do that one more time. Okay, and come back to center. I'm not feeling any popping there. Let's do that one more time. Now move the jaw to the right. Okay, move the jaw to the left. Okay, back to center. Okay, slight deviation. So if the bite doesn't look that it's aligned, and that definitely can cause a lot of strain on the right side and cause that pain that you're experiencing, going down all the way to the neck muscles and even the shoulder. Are you having any shooting pain down your arm?
Not currently.
Okay, from the assessment that we just did, it looks like you might need a retainer, even though you do not remember grinding your teeth. I think this process has been going on for the last couple of years at least. I did see marks of grinding your teeth on the upper molars. We're gonna go ahead and take some impressions today. We can take measurements and fix your bite. It's gonna be kind of like a 12-month process, and I think the pain is going to subside. Okay, so let's see. I have here, we're gonna start with the smallest. You do seem to have a small bite, so the retainer is gonna be on the lower part of your jaw. Okay, how does that feel? Good. Okay, we don't want it to be too big, too small. Let's go ahead and try a medium size. Okay, this is medium. This is definitely too big. Okay, we're gonna go with a small one. I'm just going to prepare here the alginate. Okay, so this is gonna go on the lower side. Perfect. And I'm just gonna have you bite. Okay. Go ahead and fix your lip here. Okay, and just hold it like that, 60 seconds, and it should be good. Okay, it's looking good. Go ahead and gently open. Very good. Excellent. All right, let's take a look here. I think these are very good impressions. We're gonna be able to do a very good retainer for you. Let's go ahead and wipe. Okay, I'm gonna help you clean. Okay, I'm just gently wiping to make sure that there's no residue. Okay, and would you like me to apply a little bit more Aquaphor? Sure. Okay. I hope you enjoyed this session. Perfect. I'm gonna let you know when the impressions are ready, and we're gonna have you come back and test them. Hi, Angelina. Thanks for coming in.
Thanks for having me.
Absolutely. So, when did the tension start?
So I've had this tension in my neck for about three and a half months now, and it's all day, every day, pretty much. I think it might be because of the repetitive movement at work.
Okay.
Just going back and forth a lot of the time, and then just having to not really like move around much.
Okay. Do you mind if I palpate the back of your neck? Okay. Alright, I can definitely see what this is about. Go ahead and try to touch your right shoulder with... Okay. Any pain?
Not really, no.
Okay, what about here?
No.
Okay, try to touch your chest. Any pain here? Okay. I'm gonna have you lay down and I'll take a look at your spine and see what we can do, okay?
Okay, thank you.
Okay, I'm going to brush your hair, and then we're gonna take a look to see what we can do in today's session. Your hair is a little bit tangled. We're going to do a head therapy. We're going to target the muscles that connect your back to the scalp muscles. I'm gonna feel just the tip of my fingers pressing down, trying to feel for any inflammation that may come from the base of the cranium. And palpating behind the ear. Does feel kind of tense. I know it's very hard to relax the head muscles, and sometimes just a gentle pressure can help. We're going to do a little bit of hair pulling. This helps to release the tension that you're feeling at the base of the scalp. This is a very gentle hair pulling Helps to stimulate blood flow. Okay, moving up in the center of the scalp, there are a few points here that we can definitely target. It helps to decrease inflammation. I'm going to do scratching therapy, starting with the base of the scalp. This helps to stimulate the sensory neurons. It works very well, just like a sensory brush, to stimulate the nerve cells and decrease the sensory threshold. This is very similar to scratching. It helps to stimulate blood flow. It also helps with hair growth and pain relief. This is a special stone comb. It has very white teeth and it does help to apply gentle pressure on the scalp as we're brushing it. It has antibacterial properties. And it also provides a positive energy flow. I'm applying a hair serum. It has ashwagandha exosomes. It helps with inflammation and also hair growth, as this oil is infused with vitamins and antioxidants. Okay. Now that we prepped the scalp, we're going to apply hydration. going to feel a little bit cold. I'm going to warm up the oil between my palms. And then gently I'm going to apply it in the shoulder, between the shoulder and the neck area. I'm going to use my knuckles to activate the trapezius muscle. We're going to put a little bit of cold applying pressure. work on the scalp area. This helps to reduce inflammation and activate center pressure points. Going to apply acupressure at the base of the scalp. This helps to activate the pressure points that release anti-inflammatory markers and helps to stimulate blood flow. This is very different than acupuncture. This doesn't penetrate the skin, it stays at the surface. Okay, applying a little bit of acupressure on the neck muscles, going towards the shoulders. Activating the paraspinal muscles. Using the ancient Tibetan hammer, it uses percussion to create movement and increase flexibility. apply a serum at the base of the scalp. This is going to feel a little bit wet. It has anti-inflammatory properties, and it helps with inflammation at the base of the neck. I'm making sure that we are distributing it evenly towards